What happens before surgery? In most situations, the surgery is performed as an outpatient, no overnight stay usually required, at either the hospital or an outpatient surgery center. An anesthesiologist will monitor your child throughout the procedure. Usually, the anesthesiologist reviews the medical history before surgery. If your doctor has ordered preoperative laboratory studies, arrange to have these done several days in advance. If your child is old enough to understand what surgery is, be honest and upfront as you explain the upcoming surgery. A calming and reassuring attitude will greatly ease your child's anxiety. Most children will feel better having had the pressure relieved in their ears. Your child must not eat or drink anything 6 to 12 hours prior to their time of surgery, this includes even water or chewing gum. Anything in the stomach increases the chances of an anesthetic complication. If your child is sick or has a fever the day before surgery, call the office. If your child wakes up sick the day of surgery, still proceed to the surgical facility as planned. Your doctor will decide if it is safe to proceed with surgery. However, if your child has chickenpox, do not bring your child to the office or to the surgical facility. What happens during surgery? Your child may be given a medication to help him or her relax prior to entering the operating room, pre-medication. In the operating room, the anesthesiologist will usually use a mixture of gas and an intravenous medication for sedation. During the procedure, which typically takes 10 to 15 minutes, your child will be continuously monitored including pulse oximeter, oxygen saturation, and cardiac rhythm, EKG. The surgical team is prepared for any emergency. In addition to the surgeon and the anesthesiologist, there will be a nurse and a surgical technician in the room. After the anesthetic takes effect, the doctor, using an operating microscope, makes a tiny incision in the eardrum through the outer ear canal. There will be no external incisions or stitches. Fluid will be suctioned from the ear, and a tube inserted in the eardrum. Usually, drops will be placed in the ear, and a cotton plug inserted in the ear canal. Subscribe us to know more health tips and home remedies.